Okay guys, this is one of those medications that a lot of people are on, but almost no one really understands what it's doing under the hood. And that medication is Lasix, also known as furosemide, the classic water pill. And if you've ever taken it and thought, why do my legs feel weak? Why am I cramping? Why do I feel drained? This video is for you. Let's get straight into it, guys. All I ask from you is just to hit the like button down below. It tells YouTube this is worth showing to more people. So if you like learning about health from a scientific perspective in a calm and collected way, consider subscribing too. First, did you know there were over 19 million prescriptions for Lasix in 2023? That's a lot of people taking this, and it's been around since 1964, which is a long time now. But what is Lasix actually doing? Lasix is a loop diuretic, and that part is important. It works in a specific section of your kidneys called the loop of Henle, where it blocks sodium chloride from being reabsorbed back into your bloodstream. When sodium stays in the urine, water also follows that sodium. So you pee out a lot of fluid fast. That's why doctors use Lasix for things like heart failure, swelling in the legs, which is a common reason, fluid in the lungs, liver disease like in cirrhosis, and sometimes kidney disease. It's very effective, but it's also very powerful. Now here's where the cramps and weakness comes in. When Lasix flushes out sodium and water, it doesn't discriminate. Along with that fluid, you're also losing potassium, magnesium, and sometimes calcium. These electrolytes are not optional. They are essential for muscle contraction, nerve signaling, and heart rhythm. Potassium in particular is critical for muscles to relax after they contract. So when potassium drops, muscles can start firing abnormally, which shows up as leg cramps, muscle twitching, weakness, or that heavy rubbery feeling in your limbs. Comment down below if you've been there. And this is why people often notice cramps at night, especially in the calves. You see, at night, your electrolyte levels can dip even further, and muscles are more sensitive to imbalances. And magnesium loss makes this even worse, because magnesium normally helps calm nerve firing. Low magnesium plus low potassium is basically a perfect storm for cramps. Okay, but here's something most people don't realize. The weakness isn't just from electrolytes. Lasix can also make you feel fatigued and lightheaded because volume depletion. You're not just losing water in your legs, you're losing circulating blood volume. That can slightly lower blood pressure and reduce blood flow to muscles and the brain, especially if the dose is high or if you're not replacing fluids properly. Now let's talk about the dose, because this matters a lot. The higher the dose of Lasix, the more aggressive the electrolyte loss. Someone on a low dose might barely notice anything, while someone on higher doses can feel wiped out, crampy, dizzy, and weak, sometimes within days. This is also why doctors often monitor your potassium levels closely and may prescribe potassium supplements or recommend potassium-rich foods. And here's a really important part too. Lasix-related weakness does not mean the drug is bad. It means the balance needs adjusting sometimes. The fix is as simple as lowering the dose, spacing it differently, adding potassium or magnesium, or switching to a potassium sparing diuretic alongside it. Let's also talk about dehydration, because a lot of people accidentally make this worse. Some people think I'm on a water pill, so I should drink less. That's actually how you end up feeling terrible. You still need adequate hydration, especially electrolytes, not just plain water. Drinking only water without replacing minerals can actually worsen cramps by diluting electrolytes further. Now here's where this gets serious, guys. Low potassium from Lasix doesn't just cause cramps. In severe cases, it can affect heart rhythm, causing palpitations or abnormal beats. That's why symptoms like severe weakness, irregular heartbeat, or confusion should never be ignored. This is also why routine blood work is not optional when you're on a loop diuretic long term. So if it's been a while since you had some blood work done on Lasix, it might be a good time to follow up with your doctor. So what should you actually do if you're on Lasix and feeling crampy or, let's say, weak? First, don't just stop the medication on your own, especially if you're taking it for heart failure or fluid overload. Instead, talk to your doctor about checking electrolytes, especially potassium and magnesium. Like I said, you might just be low on them. Also verify with them whether your dose is even appropriate, whether supplementation makes sense, or whether a combination approach would be safer for you. Sometimes you got to be your own advocate when it comes to your health. Second, I want you to pay attention to timing, because taking Lasix earlier in the day can reduce nighttime dehydration and cramping. Third, focus on electrolyte aware hydration, not just chugging water. And finally, listen to your body. Cramps and weakness are signals, not nuisances. And before we wrap this up, there are 3 important but less talked about effects of Lasix that you should absolutely know about, especially if you're on higher doses or taking it long term. First is ototoxicity, which is a fancy medical way of saying ear toxicity. Furosemide can, in certain situations, affect the inner ear. This happens because Lasix interferes with ion transport in the cochlea, the same ion gradients that help you hear clearly. At high doses, rapid IV administration of it, or when combined with other meds that affect the ear like your aminoglycoside antibiotics, this can lead to ringing in the ears, hearing changes, or even temporary hearing loss. It's uncommon at standard oral doses, but it's something doctors actively should be thinking about when it comes to hospitalized patients as well. The second thing is blood sugar changes, specifically hyperglycemia. Lasix can slightly raise blood sugar levels, and this happens because potassium loss interferes with insulin secretion from the pancreas. When potassium drops, insulin release becomes less efficient, which can cause glucose levels to creep up, especially in people with diabetes or, let's say, pre-diabetes. This is one of the reasons labs are monitored closely when someone is on a loop diuretic. And lastly, your uric acid. Furosemide increases uric acid levels in the blood, which can trigger gout attacks, especially in people who already have a history of gout or are genetically more prone to it. Basically, as Lasix makes you excrete more fluid out, it also reduces how well your kidneys clear uric acid. That buildup can settle into the joints, classically the big toe, so watch out for that too. So guys, let's recap. If you're noticing ringing in your ears, toe pain, dizziness, or unexpected blood sugar spikes, those aren't random. They're known physiological effects of how Lasix works in the body. Now here's a fascinating and controversial use of Lasix that a lot of people don't know about. Horses. For years now, furosemide was used in racehorses to prevent a condition called exercise-induced pulmonary hemorrhage, basically bleeding in the lungs during intense racing. Lasix reduces blood volume and pulmonary pressure, which can decrease how much bleeding happens. The problem with that, though, is that it also causes rapid fluid loss and weight reduction, which can improve performance, and that's where things cross the line. And because of this, performance-enhancing effect of Lasix was eventually banned or heavily restricted in some horse racing in many jurisdictions. It became less about protecting the horse's lungs and more about competitive advantage, dehydration, and masking other substances. So yes, the same med people take for heart failure and swelling was once a staple in professional horse racing and then got banned on race days. So the big takeaway here is this: Lasix works incredibly well, but it works by shifting fluid and minerals in your body. If you don't respect that balance, your muscles will absolutely let you know. Understanding why the cramps and weakness happens puts you back in control and lets you use the medication safely instead of suffering through side effects you think you're stuck with and have to face on your own. You should never feel alone. Your healthcare provider should have your back, hopefully. If this video helped you understand your Lasix better, hit that like button down below. It really helps get this info to people who really need it. And if you want a follow-up video on electrolytes, how to replace them safely, or how Lasix compares to other diuretics, drop a comment and let me know in the comments below. And until then, guys, I'll see you on the next one.